Every year, the world marks October as Breast Cancer Awareness Month. According to the Ministry of Health in Kenya, breast cancer is one of the leading causes of deaths for women, with an estimated 6,000 patients diagnosed with the disease every year. It's also estimated that 70 to 80% of them are diagnosed during late stages. Worryingly, current breast cancer trends show that women below 20 years are equally at risk as those above 35 in the prime of their reproductive stage. Men now also make about 2% of the diagnosed breast cancer cases. On this episode, as we raise awareness and call for early diagnosis, as current statistics show that the national uptake of screening stands at 16% alone.
Cancer has become one of the key public health challenges of our times, causing undue suffering, emotional trauma, and financial burden to our people. Cancer is the third leading cause of death in the country after infectious and cardiovascular diseases, with an annual incidence of over 47,000 cases and 32,000 deaths.
Welcome to Frontline. My name is Lincoln Wombogo. Thank you for joining us as we give a special focus to breast cancer awareness, especially amid the COVID-19 pandemic. Joining me in studio is Mary Kienti, diagnosed with breast cancer and currently undergoing treatment. Also joining us here today is Dr. Beatrice Migingo, a medical officer at the Metropolitan Hospital, as we look through the lenses, life journey, lessons and tools to help you tell the signs of breast cancer, its management and prevention. Ladies, thank you for creating time. Perhaps Dr. Beatrice, we can start with you. What are the causes of breast cancer?
If you'd allow me, I think the best way to approach that question is the risk factors.
The risk factors?
Yes.
Okay. What are the risk factors of breast cancer?
So, as with most cancers, there are lifestyle risk factors. A good example is excessive alcohol intake. You also have excessive smoking. Those are things that can actually lead to cancer. If you're looking at people who if someone does have a history of breast cancer, they are also at risk of getting breast cancer again. It's still a possibility. If there's anyone within the family that has had a history of breast cancer, we also have a familial history of breast with ovarian cancer. It has been mentioned before, the BRCA1 and BRCA2 genes, which are mostly associated with that. If you look at other things which we can say in a way are avoidable or can be changed. So you have someone who's on hormonal therapy. Especially this tends to affect those who've already gone into menopause. There is the effect of hormonal therapy, which actually increases the risk of breast cancer. You have women who have getting their first pregnancy when they're much older, so we usually say from about 35 years and above, they're usually at risk of getting breast cancer as well. You also have people who either start their menstrual period at a really early age, or those who also start their menopause at a much later age.
What's early age for?
Early age, we would say less than 12 years old is where we would say that is what we call the early menarche. Ideally, they're starting their periods at a very early age.
At what point should they get screened if they start at 12?
It's more of being aware of the possibility. I think it would come into the point of the screening is as women and men as well. It's the being aware of you as a person. You are the first person to realize a change in your own body. So this is where we talk about the self-breast examination.
Dr. Beatrice, allow me to cut you short. You spoke of alcohol and, of course, family history.
Yes.
Are these unique to men and women, or is it just to women?
No, they're not unique to men or women. Because if you look at family history, for example, if it is a genetic mutation, now, for example, the BRCA1 and the BRCA2, if someone within the family has it, mostly especially with what we call your first degree relatives, so like your mother, your sister, if they're able to pass on the gene to someone, or to you as a person, you are still at risk of getting the cancer, whether you're male or female.
Okay.
Of course, breast cancer is mostly common in women, but it shouldn't go to say that men are exempted from this as well.
Okay.
As with alcohol and smoking, there are risk factors for many cancers, and in the same scenario, it doesn't exempt breast cancer as well.
Okay, thank you.
Yes.
Mary,
Yes.
Mary Kieti is a
Yes.
breast cancer survivor, currently undergoing treatment. Mary,
Oh, yes.
when and how were you diagnosed with breast cancer?
Okay, I am 2017. I diagnosed with breast cancer. I had a tumor, and then I went to St. Mary's Hospital, and then they told me it's just a normal thing, and I just take it easy. I continue with my work, but for some times the tumor was still there, growing. So I went to the same hospital again, and they I tell them that the tumor is still there. So the doctor advised me to do biopsy. Then the results came that I had a cancer,
What stage? Do you know the stage at that point?
stage 3.
Stage 3.
Yes.
And how has the treatment been for you now?
Okay, I started with chemotherapy immediately because the tumor was too big. Then that was 2018, yes.
In 2018?
Yes.
Dr. Beatrice, for Mary it was a tumor. Does it always present itself as a tumor?
I think it depends on when it is picked up or when it's found. With some cancers, it's different for most people. If someone is able to pick up on the early signs, and when you present to the facility, they're able to appropriately, get the history examination and investigate, then hopefully the ideal would be to get it earlier on before it actually progresses to the stage where you have like a tumor, more like a big mass that is either visible or very enlarged. So usually what you will see in terms of the early signs is someone may have a nipple discharge, and the symptoms are more or less the same in men or women. But so you'll have something like a nipple discharge, which is not normal, especially if you're not a lactating mother. Then having a nipple discharge is out of the norm. If you're having any pain in any part of your body should raise concern to seek advice. If as a woman or even as a man, when you're doing the self breast examination, if you feel a mass or a lump that, especially if you're consistent with it, that hasn't been there previously, that should also warrant to be assessed. For some people, it can be even a lump in the armpit, which we call the axilla. So you may not even necessarily feel a lump in the breast, but you can feel it within your armpit. That should also be assessed. You also have other things like when your skin starts to change. Either you have a rash, it starts looking like an orange peel. You know the way the orange peels have the dimples?
Where?
On the skin, anywhere, the skin on the breast, around the breast area. So if it starts looking like an orange peel with the dimples, that is one of the signs. If you start having a rash, that could also be a sign. There is instances where a rash could also be what we call eczema on the breast, but it's also good to still seek advice, because there is a skin change that may look similar to eczema, but it would actually be a sign of cancer.
Whoa.
Yes.
Mary, please
Yes.
tell me your experience from
Okay.
treatment, and maybe even before that, were you having any pain anywhere else?
No.
No,
No.
just that lamb.
Yes.
Please explain to us your experience of treatment
Okay.
and the whole journey and the expenses
Okay.
and the changes.
Okay. Thank you. That time, doctor told me to start chemotherapy immediately, whereby so that the tumor reduced the size, because the size was too big. So I went 6 cycles, and I was going after every 3 weeks, and then from chemotherapy, then mastectomy. They removed the whole breast. From there, radiotherapy. Yes.
How about, the affordability of the chemo?
Okay, chemotherapy is tough. It's very tough. For one, you lose appetite. Secondly, you lose hair. so many things. Yeah,
How-
and vomiting. Yeah,
How did you cope with that?
I was given medicine to avoid vomiting. Yes,
Your family?
my family was so concerned, and they were so supportive. Yeah,
Okay.
yeah.
Thank you, Mary. Is it always like that for everyone, Dr. Beatrice?
I think it depends. It's definitely not the same. When it comes to treatment, it definitely depends on the stage as well as the type of breast cancer you have. So as Mary has said, like for her, they did a biopsy, which is usually something standard because you also need to know what you're treating. Because with breast cancers, there's something we always look at with a biopsy is if some of the cancers are actually what we call hormone receptive. That would also affect the treatment. But the mainstay is when they do the staging of the cancer, so they obviously do imaging to assess how big the tumor is, where it has spread. Has it only spread to the lymph nodes? Is it just the skin and the tissues below, or has it gone beyond that? So depending on the stage, then your treatment can be tailored to you as a person. And this is the mainstay work of the oncologist, because they look at you as a person, they look at your current health, because we also need to consider that some people may have cancer and they still may have other chronic illnesses. You also look at someone's preference. The patient's preference must still always be taken into account. As much as the doctor gives the advice, you still need to ask the patient what they're comfortable with once you've given them the available options. So in terms of treatment, there's surgery. There are patients who get hormonal therapy after surgery. There's also those who get chemotherapy as well as radiation therapy. The order in which it is done is something that is tailored to each patient with the oncologist.
Mary,
Yes.
recurrence.
Okay. It was last year, 2020, whereby the cancer went to the other breast. I had another tumor.
Before even that, 2017 you were diagnosed.
Yes.
2018, what happened?
2018, I was given a chemo and surgery and then radiotherapy.
And after that you thought
And
it's
after,
over?
yes, and I was on tamoxifen for 5 years. Yes.
2020,
2010, 20, it recurred.
it recurred.
Yes.
How was it like for you?
It was very tough. Let me say that it was so bad because I was not expecting that. Yes. I was not
We take a short commercial break, but we'll be back shortly with Mary Kieti, diagnosed with breast cancer and currently undergoing treatment, and Dr. Beatrice Migongo, a doctor practicing at the Metropolitan Hospital. For now, here's a brief COVID-19 fact check on what happens to our bodies when we recover from COVID-19.
We know that individuals who have even severe disease, mild disease, and even asymptomatic infection do develop these antibodies. Studies are underway to show us how strong this immune response is and for how long these antibodies last. What we understand from these studies, and there are many that are currently underway, so we still don't have a full picture yet, is that these antibodies last for many months. Some studies showing that they last for 6 months and possibly longer.
Welcome back to Frontline. If you're just joining us, our topic of discussion is breast cancer awareness. We continue this discussion with Mary Kieti, diagnosed with breast cancer and currently undergoing treatment, and Dr. Beatrice Migongo, a medical doctor with the Metropolitan Hospital. Beatrice, Mary, before we went for a short commercial break,
Yes.
you were explaining to us the stages and what happened. 2017 you were diagnosed, 2018 you underwent chemo and the surgery, and 2020 it recurred.
Yes.
Please continue with that.
Thank you. 2020 ilirudi tena the other breast and ilikuwa na tumor bado, and then it spread, widespread.
What do you mean widespread?
Okay, it went to my bones and between my chest, kulikuwa na nodes. Is it correct? Nodes? Yes. According to the scan.
Dr. Beatrice,
Yes.
chances of recurrence?
Is still a possibility. The treatment, ideally what happens with the treatment is you're doing your best to get all the cancer cells, ideally. The chemotherapy, the radiotherapy, najaribu kuwa cancer cells, if I can say so. But there's still a possibility that sometimes even with the chemotherapy, the radiation, or even maybe with surgery, that there can still be some cancer cells that somehow evade or don't get attacked, or they're not affected by the chemotherapy, if I can say so.
Chances, percentage maybe?
I wouldn't want to mislead on the actual figure, but it
How
definitely...
often does it happen? Given a case of 10 patients.
It probably could happen in about maybe 3 to 4. It's still a possibility. Yeah, but then again, I think it also depends on the type of cancer. It all goes down to also the type of cancer, because different breast cancers have different ways in which they're. Some are very aggressive compared to others. Yes.
Cool. For instance, let's take Mary's case, because she's right here with us. Her recurrence, could you tie that to her being diagnosed stage 3?
It could be, but remember at the beginning I had said having breast cancer before still gives a risk for and repeat breast cancer. It is still a possibility that maybe at that point when it was picked up as a stage 3. There's still the possibility that even during surgery and chemotherapy, then that the cancer cells were not all attacked, and it still got the chance to then spread to other parts of her body.
Other parts of her body, does it still go as breast cancer?
It still goes as breast cancer. What we say is you will have the primary cancer, which is the breast cancer, and then it is, because the breast cancers, you're looking at the cell type ideally. So it is still breast cancer, it's just a metastasis, what you call the metastasis of the breast cancer, which is the primary cancer.
Dr. Beatrice, once she was diagnosed on one with a stage 3 breast cancer, when it recurs, does it recur as stage 3 or 4 or 1? Where does it start?
No, it's not. It's not quite set in stone.
Okay.
Yes.
Okay.
Because I think it then again it also depends, because I think with the shortness, the short distance, the short time lapse between, could be maybe that's why it came back as it has further progressed, but it's not fixed.
Mary, has the treatment process been the same with the first time and the second time?
No. The second one, I can say now I'm getting the real treatment.
Unamaanisha nini na the real treatment?
Yes, because the other side kulikuwa na tumor iliisha.
Yes.
Yes, na kwenye kulikuwa na maumivu kulipona. I was on wheelchair because cancer ilikuwa imeenda kwa spinal cord and it affects my leg. So right now you see I can walk.
Yes.
Yes.
We thank God.
I thank God for that.
COVID-19.
Yes.
How has it affected you?
It really affects me. It really affects me. Because nilikuwa naogopa corona mwanzo. And I was working by that time, but si ile kazi naweza sema, but I was working as a house girl. Nikakuja nikastop hiyo kazi. I went to stay home with my family. And then kupata fare ya kwenda Kenyatta, it was a disaster. I used to borrow people. Yes, people stood with me up to today, even now. Yes.
Dr. Beatrice, COVID-19 and the impact it has on breast cancer patients.
It's definitely had a negative impact, I would say. One is the availability of them to go to facilities. We definitely had the restrictions. Some patients, as much as maybe say there is availability of services here, if someone had maybe opted to go outside the country, the travel restrictions definitely caused a stumbling block in their path. With also cancer patients undergoing treatment like chemotherapy, they are usually at an increased risk of infection. So that is definitely something I'm sure that has created a sort of anxiety for them, because they're really battling one thing and now comes COVID, and it's something else they also have to be very cautious and very aware about, because they are still at risk of contracting, given their immunity has been affected by the chemotherapy.
So what's the worst that could happen? You have breast cancer, then you contract COVID-19.
It's a very it's a good question. Not to instill fear, but it is the reality. Cancers are known to be diseases that increase your risk of clotting. With COVID itself, there is also the increased risk of clotting, given how severe the infections can be towards your chest. And we've seen also with COVID patients, they tend to get what we call a pulmonary embolism. So when you have COVID and you also have cancer, it definitely increases the fold or your risk of getting a pulmonary embolism. And if unfortunately someone is not able to get to a facility in time, pulmonary embolisms are definitely a deadly diagnosis. It is an emergency situation that requires immediate medication for that. So I feel like the aspect of them having cancer does increase their risk, especially if they have a co-infection with COVID. But then it is also good to remember that what we've seen with COVID is with each variant, the presentation is also changing. So what may be set in stone for what is in one patient may also not happen in another patient. So it really varies a lot. Yes.
Mary,
Yes.
given your experience,
Yes.
how would you rate the efficiency of the healthcare system in Kenya in regards to addressing breast cancer especially?
Okay, before you continue, or
please.
before I answer your question,
Please,
I would like to answer about how COVID affected cancer patient,
please.
especially me. I'm talking about
Okay.
myself. For one, ile siku ya kuwekwa chemo, some of the medicine were out of stock. And I used my money to go to Nairobi hospital to buy in order niwekwe hiyo dawa. And that medicine is very expensive. Sometimes nilikuwa na miss chemotherapy because I had no money. You see? So I can say that there is a lot of challenges about COVID, fighting cancer and then COVID. Yes.
Efficiency,
As in?
unaonaje kuna mahali serikali ama the healthcare system wanafaa wa improve kidogo?
Yes.
Ama wako tu sawa?
Wanafaa wa improve sana, si
Sana.
kidogo, sana, about medicine. In fact, at Kenyatta there is no medicine. Now you are supposed to take that medicine. Okay, Kenyatta unaweza chukua kulipia na NHIF, but there is no medicine. So unafaa uende to another doctor, hospital or pharmacy, which is very expensive. Some people cannot even afford to buy, but with NHIF you can get it. So naweza omba walete dawa zote Kenyatta or any hospital. Yes, kukisi watu wasi wanafinyiliwa sana, because that medicine, I'm telling you, it's very expensive.
Dr. Beatrice,
Yes.
you've had her plight. What are the risks of missing?
I think the major risk would be if you're not getting chemotherapy, especially if we can give her example. She was given, for the first course of treatment, chemotherapy was given to her too before surgery. We usually do this so that we can decrease the size of the mass, so that surgically you're able to remove it, and also in a way reduce the risk of complications given the size. So in a patient like such, chemotherapy, if someone isn't getting and say they have been advised for that, that means this mass is still being given the opportunity and the time to continue growing. Within, from the moment they were to start, from the moment it was diagnosed to say the moment they eventually start their chemotherapy, a lot could have changed, including their staging, because this cancer is not it's not being treated, it's continuing to grow, and within it continue to grow, it still has the opportunity to spread.
Dr. Beatrice, how often should one get, checked?
So for women and men, I think the most important thing, it starts with us ourselves. Self-breast examination, because you're the first one who will notice a change in your own body.
Yes.
That is something women can do, men can even do anytime you shower.
Explain.
Anytime.
How?
So usually with a breast examination, ideally you'd want to have your hand above your shoulder, preferably with your arm behind your hand behind your head. Ideally you want to start examining from the nipple going outwards. This way you're going out in circles. You make sure you cover each area of the breast tissue, if I can say. And then once you've covered the whole breast area, you also want to move up as if you're heading towards your armpit. Because remember, we had said that in some people they can also feel a lump or they can have pain within the armpit. And what we're looking for there is what we call the lymph nodes. So sometimes a cancer could have spread to the lymph node, and maybe that's where you feel the issue is starting out as. So once you do that, if at any point someone they feel a lump, something that's not ordinary, especially if you're consistent with examinations. A month ago you didn't feel anything, and then now you're starting to feel something. The most important thing is to go get checked.
Go get checked.
Now, in terms of go get checked is present to a hospital, a clinic, let them know that what your problem is. Depending on your age, so with younger ladies, especially, I would be saying from around 40, 35 and below, our breast tissue is usually very dense. So a mammogram might not be the ideal initial investigation because it may miss it. Usually what you do is an ultrasound. Then with an ultrasound, then there's now the mammogram. They assess. Not all lumps are cancer, but you don't know until you've ruled it out.
Thank you.
Yes.
Thank you, Dr. Beatrice. So we should had more time. My director tells me your time is up. We have to pay some bills. Thank you so much, Mary Kieto, who is currently battling breast cancer, and Dr. Beatrice Bigongo with the Metropolitan Hospital, for creating time. Till next week, same time, stay safe. My name is Lincoln Wumbogo, and my producer has been Harry Chimere. Good evening.